Hi, I'm Dr. Lee Thornton for the Plastic Surgery Channel. One of the most difficult areas to grasp as a patient is when and how to choose between the need for breast implants alone versus a breast lift alone, or the need for both procedures. This is a very complicated area in plastic surgery, but I'll try to simplify it as much as possible. It's certainly an area that requires the evaluation and expertise of a board-certified plastic surgeon with experience in all of these procedures in order to achieve a good result. First, let's look at what implants are really designed to do. Primarily, implants add volume or size to the breast, and in doing so, they change the shape of the breast as well. They make the breast fuller and can make for other shape changes, such as filling out the breast, resulting in a more rounded breast, as well as adding fullness to the upper portion of the breast, which has lost its fullness due to age or pregnancy. Implants come in different sizes and different shapes or profiles and can be filled with saline or silicone gel. Therefore, they can be selected to correct some differences in shapes and sizes of the breast. In fact, it's the norm that most women have some degree of asymmetry naturally. So, if the asymmetry of the breast are not too great and the breast does not have too much sagging, dropping, or excess skin, an implant procedure alone will often be all that's needed. However, choices get more complicated when we have differences in size or shape that implants alone cannot correct. While it's true that an implant alone may lift the breast or the nipple to a degree, the rule is a breast implant should only be used to obtain a size that is appropriate for your body, and an implant that is too large for your body should not be used just to fill out loose or sagging skin to avoid a breast lift when it's needed. In other words, the use of an implant that's too large based on what your body will safely tolerate is not the answer to avoid a lift and will lead to problems requiring more complicated surgeries in the future. Now, if you already have a breast size that is adequate, you and your surgeon should give serious consideration to performing a breast lift alone. Remember, there's no way possible to add an implant to your breast for fullness and not also increase the size of your breast. Mastopexy or breast lift can give a wonderful, long-lasting, and natural result without the need for an implant. The mastopexy alone does not give quite the fullness above the nipple long-term that you can get with an implant. However, the trade-off of the lift alone without the implant is often the best choice when your breast is already big enough. Also, with rare exceptions, it's not appropriate to remove your natural breast tissue and place an implant just to get that implant look or fullness up top. So if you have enough breast size naturally, you can use your own tissue and not an implant and just have the breast lift. I've often seen patients sometime after they've had a combination of a lift and implants and they feel that they're too big and they're beginning to sag again. The fact is, the heavier the breast, the more it drops. Regardless if there's an implant or not, implants as a general rule do not keep the breast from sagging and can often make sagging worse when the breast ends up too large for your body. Likewise, if you do need an implant and lifting, but do not want the additional scars of the breast lift, it's a bad idea, again, to use a larger implant than you need just to avoid that lift. These decisions will lead to complicated problems requiring more complicated future surgeries. To summarize, remember that with rare exceptions, breast implants are used for increasing breast size and for relatively minor shape changes, while a breast lift is sometimes needed with an implant to overcome greater amounts of excess skin or sagging and can be used alone to correct sagging when the breast is already adequate size.